All right, welcome everybody. This is Greg from Whitehall. If your practice has plateaued and it's been 3 to 6 months where there's been virtually no growth, this is kind of a good refresher course for you to go in and try to figure out where the problem is. There's two categories that the problems fall under. One is patient flow. We're not getting enough patient flow. If that's not your issue, meaning, hey, we're getting a lot of new patients, we got a lot of hygiene, but our production's no good, then it's case acceptance is your issue. And so we're going to go down this list of possible problems that could be causing this, and hopefully one pops out to you. So one thing, obviously, is capacity. Do you have enough doctors? And do you not have enough rooms to actually produce more? You could be getting very good case acceptance in terms of patients saying yes, but physically you're out of space or you're out of doctors to actually produce it in that month. And so when to know if this is your issue, you want to start tracking what production you already have on the schedule the first week of the month. So if it's December 1st, you want to look at what do we have on the schedule for this month already. And if it is getting to the point where, let's say your goal is 100,000 and you're at 80,000 already before the month starts, there's a capacity issue. That production should have actually been done the month previous. It's just we don't have enough doctors or space or enough assistants even to get it done in the month that it was actually sold in. So look out for that. So that is one thing that will catch us out is capacity. Some other issues that come up with capacity is doctor speed. Being slow, Greg. There are certain metrics we like to go by where we go, okay, he's probably slow. We like to see a general dentist working by themselves be able to produce around 80 to 100,000 of restorative dentistry a month, and for them to go, I'm full at that point, like I'm busy, I don't really have much room to add. But if you're at 50,000 a month, 60,000 a month,
and you're completely busy,
yeah, you've got an issue with either speed or you diagnose a lot of fillings. You're very ultra conservative in terms of the mainstream. So those are some issues that pop up. So really not in case acceptance. Patients are saying yes, you're just not getting them done efficiently. So you want to look at that. Next, and this is probably one of the bigger ones, is doctor's case presentation style. And in not getting good case acceptance, doctors have personalities and they have certain styles on how they deal with patients and the type of dentistry they like to do, whether it's quadrant or a tooth at a time, or and that can have consequences on case acceptance. What we'll see typically, case acceptance problems being that you're pushing for too much treatment. You're getting a lot of zeros. So you want to track this. If you're thinking that you might have a case acceptance issue, you want to track your new patients to the practice and see which percentage of them do follow through on some restorative treatment in that month. So if you have 100 new patients that were diagnosed with some restorative dentistry, you should get 70, 80% of them to act on something in their treatment plan. If you're at 30 or 40%, that's a case acceptance issue. And there's a lot that goes into that, and that's kind of some of the things on the later of my list. But as far as the doctor's concerned, their side of it can be overwhelmed. And you want to be careful there. The other thing is confusion. So you got assertive and non-assertive doctors. Assertive doctors will push for more treatment. Non-assertive doctors will confuse and not put any sense of urgency on getting it done. So you want to look at those two issues. Are we having issues with the way the doctor presents? And obviously working with your owner or your associates on fixing those things. And each one has to be kind of divided out, meaning if you got an owner and an associate, you got to separate them out and view them as two separate almost practices in terms of case acceptance. The owner might be doing a great job, the associate might be doing a poor job, but together it creates a poor case average. And so it can be tough to spot. You got to find out where the problem is. And so please track both doctors separately. So yeah, there's a whole host. These are the common ones to go look at. All right, thanks for listening.